Hello everyone, I am Mark Iorio, your host with Dr. Gerald Smith. We're talking about cancer deconstructed. We are in episode number 10, Reversing Cancer the Old-Fashioned Way. Doc, this is it, the grand finale.
I can't believe it.
I know, it's been fun.
Yes.
I really enjoyed it. I really learned a lot, and I appreciate everything you've taught me and our audience.
Well, thank you so much. And to be honest with you, this is why I do a Thursday night blog, because it forces me to keep up with the information and keep digging new information. And everybody wins. When you got your health, you got everything.
Absolutely. There's a great flow of information here. So when you talk about reversing cancer the old-fashioned way, what do you mean by that?
Basically, reversing cancer the old-fashioned way is using natural remedies and also getting back to basics, like pH. If you're too acidic, okay, you have a low oxygen level, and cancer thrives on low oxygen. If you don't exercise, the toxicity builds up in the lymphatic drainage system in between the cells they call interstitial cells, and you get sluggish because the poisons prevent the cells from working properly. Also, you have to increase your oxygen level by becoming more alkaline, eating dark green leafy vegetables. You can even take some baking soda in water for a quick upper for alkalinity. It actually works. Or if you have heartburn, if you ever get heartburn, you take like a half a teaspoon of baking soda and some water. Within 3 minutes, your heartburn will be gone.
No kidding.
Honest to God, it works really well. So simple little remedies like that. Cancer is not as a demon as people or the medical establishment make it out to be. It's because they're not understanding the physiology of the cancer. So the key is eating real foods, living foods, organic foods that are high in nutrients, and drinking water that's been filtered, because if you don't drink filtered water, your organs will filter it, and you're going to be in deep trouble, because that's where your organs sludge up and they go, haywire. And lastly, having a positive attitude. They say if it's mind over matter. If you don't mind, it won't matter.
Right, exactly. Yeah, I love that. You mentioned high alkalinity, right? High acidity, right? How do you determine that? What's the mechanism to determine whether or not I have a high acidic content?
Well, it's real simple. You can go to the pharmacy and literally you can purchase pH strips, and you take some saliva and you spit it, put it into a spoon, put the strip in there, saturate it, wait 15 seconds, and then you match the color of the actual test strip with the color markings on the box, and it'll tell you exactly what your pH is. If you're 6.5 and below, you're too acidic, and that sets you up for degenerative diseases and cancer. Your body should be up 7.35 and 7.45. When you're more alkaline, your oxygen level is higher, and you're not going to get sick.
Yeah. So your suggestion is green leafy foods,
Vegetables.
Right? Vegetables. Yeah.
Yeah. Celery, kale, collard greens, bok choy. All the things that you don't like.
Right, exactly. I love all that. When you talk about that, exercise and pH, can you give us kind of some examples of what you're referring to in terms of detoxifying the body?
Well, when you're doing exercise, your lymphatics are flushing the poisons through your liver. See, the blood goes through the liver every 3 minutes of your entire body. So the liver has the chemical processes of breaking it down and then storing it in the bile. And then when you eat, your gallbladder squeezes down and the toxins pass out. So that's one interesting way of resolving the problem.
And can you give us other examples?
Yeah, basically, you got to get your intestines cleaned out. If you take food-grade diatomaceous earth, for example, it scrubs the walls of your intestines, gets rid of a lot of gunk in there, so to speak. It lyses parasites, and 50% of the American population have parasites, and it also absorbs the poisons in your gut. So the thing is, you have to realize your intestines represent 60 to 80% of your immune system. If that's toxic, so goes your body. And even more importantly, there's a direct connection between your colon and your brain. It's the vagus nerve and the lymphatics. There's a 90% one-way motion of the toxins that are going from your colon to your brain. That's why there's so much dementia today.
What you talk about diatomaceous earth, do people understand what that really is? What's diatomaceous earth?
Well, that's what they use in swimming pools to process the water going through the filtration plant. And, it's innocuous, it's inexpensive. You can get, I think, 2 pounds for $12. And if you start off with a teaspoon and 8 ounces of water first thing in the morning for a week, then bump it up to a tablespoon in 12 ounces of water and do that for 90 days. It's a miraculous. I had one patient who had spiking blood pressure for 15 years. After the 90 days of diatomaceous earth, his blood pressure went back to normal.
Is it tasteless, or can you taste?
It's tasteless.
Tasteless.
Yeah.
Okay. All right. And so, once the liver's cleaned out, Doc, what transpires in the body? What sort of things happen to our body once the
Well,
liver...
the cleaner your blood is, the healthier your organs and tissues are going to be. In addition, so once you clean out the filter, then you want to open up the avenues of excretion, which is your lymphatic system. Mm-hmm. And in my practice, I use one of 9 different homeopathic remedies, and I test to see the energy pattern of the remedy if it matches the energy pattern of the patient. So first you want to clean the filter, then you want to open up the avenues so that the cells can dump the poisons and get them to the liver to process it. And the third thing that we do is get rid of the heavy metals, because they disrupt the physiology of the cell, make them to go haywire. So, if you do these simple basic things, and then the biggest problem with cancer especially is glyphosate. And insecticides, pesticides, and herbicides. And it's in our drinking water today, in the rainwater. So even if you're buying organic, you're getting it laced with the herbicide, and the problem is there's over 40,000 lawsuits against Monsanto for causing cancer from, this nasty herbicide.
Glyphosate.
Yeah, glyphosate. It's unbelievable.
Interesting. So when you go through this process, at your office, how do you mentioned a lot of things here, but removing or detoxifying the lymphatic system, how does that work?
Well, basically, we go through a 6-stage process. Mm-hmm. The first stage, we supply the liver with the nutrients like superoxide dismutase or glutathione or curcumin, for example, or B vitamins, and that enables it to process the poisons that is pulling out of the blood. Then the homeopathic remedies open up I call the sewage system, the lymphatic system, allowing the poisons to go from the cells to the liver. Then we use chelating agents like in amino acid formulas to grab onto the heavy metals and pulling out of the body. And then we use homeopathic remedy like isopathic phenolic rings, which works miraculously to pull glyphosate and other pesticides and herbicides out of the body. There's other antioxidants that can be used for chemicals that we do. And then we go after the infections with natural antibiotics, so it's not going to damage your healthy bacteria in your intestines. Mm-hmm. And then lastly, we go after the trapped vaccines from childhood. And let me tell you, they get trapped in different organs. So if you follow this 6-stage process, the sequence, you're going to purify the body, boost the immune system, and once you take away the splinter or the initiators, the cancers disappear.
And this 6-step process, how long does it typically take? I mean, if you're getting cooperation from the patient and they're coming on a regular basis, typically what's that process?
Great question. I had one patient from Detroit who was sick for 7 years, mm-hmm. and it literally took a year to detox this guy. I mean, he was sleeping 2 hours a night. That's it. Wow. He was wrecked. And I was the first doctor that he said made sense. And after the year of therapy, he got his life back. Other people, sometimes within 3 months or 4 months, they can reverse the illness.
Wow, that's incredible. You have some other interesting stories for our viewers. Rick Williams comes to mind, right?
Yeah.
Can you share some of that information about?
Yeah, basically Rick he's an architect, he lives in Manhattan, and he came to me and he had a melanoma on his forehead, mm-hmm. and we literally put him on some basic nutrients, and in a very short period of time, his cancer disappeared. And we have a great little interview that we're going to be presenting of Rick. And, you know, you don't have to get sliced and diced and irradiated and glow in the dark and get poisoned with chemotherapy. There's much kinder and gentler ways of removing the causative factor to reverse the cancer.
Yeah.
My name's Rick Williams. I've been seeing Dr. Smith or our family's been seeing Dr. Smith for well over 10 years. And about 10 years ago, I had noticed a brown spot on my forehead, somewhere above my right eye. And Dr. Smith diagnosed it and prescribed iodine. I think it was iodine combination, which I applied. And it definitely worked. It would it seemed to kill the surface of and I literally could peel it away. And it took some time, but after a number of months, it totally vanished. And but I kept a close eye on it. And then I noticed a few years later it came back, and I started using the iodine again. And I noticed that this time it wasn't quite as effective. It actually was much slower in acting. And we came and saw Dr. Smith again, and told him all about it, and has prescribed actually what I'm still using are apricot kernels, and that really worked. It vanished pretty darn quick, and I still take those. So it's pretty amazing. It's truly amazing. I was it's I keep watching it, but yeah, and to the day I take it almost every day, the kernels. So okay.
Well, that's interesting and simple. Let's see. We're going to have one of your patients come in and talk to us here, Carol, right?
Kessler.
Carol Kessler. But that's I think we're going to do that for next time, right?
Yeah, and that'll be edited into this last section,
yeah,
and
great.
that'll wrap it up.
Doc, it's been fun. It's been a great time, and I can't wait to interview Carol and some of these other interviews and conversations.
Well, thank you so much.
You're welcome. It's been a pleasure. Ladies and gentlemen, Cancer Deconstructed. Dr. Gerald Smith and I have been talking about this for the last 10 episodes. We will have more information for you with an interview with Carol Kessler, but there's ways to get in touch with Dr. Smith, websites, a whole bunch of reading material, Cancer Deconstructed, removing the splinters, right?
Yep.
And healing the body.
Yeah, it's a fun journey, and the thing is, when you share your knowledge with the public, everybody wins.
Absolutely. All right, Doc, thank you very much.
My pleasure.
Ladies and gentlemen, that's a wrap for episode 10. We will come back with an interview with one of Doc's patients, a great case study with Carol Kessler. So stay tuned, and we will share that information with you with Carol soon. Well, hello everyone. Welcome back to Cancer Deconstructed. I am Mark Iorio, and we've been doing a 10-part series with Dr. Gerald Smith. And Dr. Smith has brought a patient of his in today, and this is Carol Kessler. Carol, welcome.
Thank you.
You're welcome. Great to have you.
Nice
Great
to
have
be
you.
here.
So, Doc brought you in to show our viewers a contrast between the conventional sort of cancer treatment and a more natural, integrative approach. You had a reoccurring lung cancer, correct?
Yes.
Yeah. So, how did you get to Dr. Smith?
My chiropractor introduced me or told me about Dr. Smith and recommended that I get in touch with him.
Yeah. What was the issue?
I had lung cancer in the right lung.
Okay.
And I had the cancer removed surgically.
Mm-hmm.
And when I told my chiropractor I was sorry that I ever did that, he said, that's when he said, you should go see Dr. Smith.
Dr. Smith. Would you go through that again? Surgery?
No way.
No way, right?
No, I will not.
Pretty invasive.
Very invasive. The surgery was a tough one. The recovery was a tough one. And no, I would never do that again.
Wow. It's got to be a very, very difficult recovery period and painful as well.
Yes,
Yeah.
it was very painful. Very painful.
Carol, when you went to see Dr. Smith and he examined you, what did he find as the sort of the causative issue or causative factor?
He found an infection in a root canal tooth that I had. There was cytomegalovirus, and he recommended that I get my pathology slides from the hospital.
Right.
So I did that, and I brought them to Dr. Smith.
Really? Cytomegalovirus from a root canal, right? What did the slides show?
The slide showed the cytomegalovirus, mercury, and a pesticide in the cancer tissue.
Pesticide. And where do you think that all came from?
Oh, anywhere. The food we eat, medicines. I don't really know.
Yeah. Would you compare this surgical approach to treating your cancer? How would you compare those two variables?
Well, the cancer surgery was very invasive. It was horrific surgery, a long recovery, and just invasive. And Dr. Smith's approach is getting to the root of the problem, finding out why my body is going through what it's going through, what's causing this cancer to show up in my body.
Right.
And that is the approach that Dr. Smith took, was to be less invasive.
It's amazing to me, Carol, that you go through something like this, and Dr. Smith does an examination. We're going to bring him on at the end of the program, but if you had this choice, right, in the beginning, prior to opting out of surgery versus this less invasive process of removing the virus, right? CMV. Would you have done that?
I would have definitely opted out of the surgery. Yes.
Yeah.
Yes.
So let's talk about lifestyle for a second, because you touched on this a little bit ago, with mercury and pesticides that the slides show, the pathology shows. What lifestyle changes did you make after the diagnosis?
My diet, I was becoming more conscious and aware of what I was eating and not eating, and exercise, and the supplements that Dr. Smith had recommended.
Yeah.
Like, I changed a lot of things in my life.
Amazing. I mean, much more organic.
Yes.
Maybe supplements that you hadn't taken before.
Correct.
Right?
Yes.
Feel better?
Oh, 100%.
Yeah.
Yes.
More energy?
Yes. Yes.
More zest for life, right? A lot of times, people are taking, we're eating and ingesting hormones and things that
Yes.
are so toxic to our bodies, right, Carol?
Correct. Yes.
Yeah.
Yes. It's a peace of mind knowing that my body, if given the right things, can heal itself, and these supplements that Dr. Smith recommends is specifically for me.
You look great. You look fantastic. You look healthy. You're vibrant. Your face is, vibrant. You have that good feeling. Your doctor, your prior surgeon, did he or she see the pathology and the slides and the results from Dr. Smith?
Not from Dr. Smith. They saw the slides because they came from there. I had to go and get a CAT scan every 3 months after the surgery. And when the cancer came back in the left lung, it showed up 6 months later after the surgery. So they're like, what do we do now?
Right, sure. Yeah.
So that's when they said you have to have a CAT scan every 3 months. Well, 6 months after the initial findings, that's when Dr. Smith had got rid of the cancer. So when I went back for the last CAT scan, there's nothing there.
Right.
Like, wow, this, they couldn't explain it, but I could explain it.
Right. And what did they say? How did they react to that?
They were just like, they didn't have an answer. They didn't have an answer.
Yeah.
They didn't respond.
It's amazing. So Dr. Smith and I have talked about this in almost every episode. I think we've got to get away from the conversation about conventional medicine versus alternative medicine, and say that alternative medicine should be more conventional, right?
Yes.
Right?
Yes.
Rather than the opposite. And I think the AMA, which I think he calls the American Mafia Association, let's just put it out there, right? Probably needs to change that vernacular, but they're not going to do that, of course.
Right, correct.
You were on many vitamins. I mean, what are some of the supplements that you've been on with Dr. Smith from his recommendation?
Yeah, he customized what I should take, like magnesium orotate. I'm on astragalus. There's a list of different ones that I'm on. AF beta block, beta food. There are many supplements that is just ordered for me.
Right. Specifically for you,
for
yeah,
me.
yeah. So it's a kind of a standard protocol of all he put you on a customized program,
Yes.
basically. So everyone, we'll have to ask him later on, but
Yes.
everyone's different, right? Everyone has a different protocol.
Yes.
Yeah.
I have to write them down because, like, just to remember,
right, of course, yeah, yeah,
what
yeah,
I'm on
yeah.
and what he prescribed.
So let's go back to the root canal
Yeah.
issue. What treatment did Dr. Smith use to resolve the root canal problem?
He
or issue?
extracted the tooth.
He took the tooth, okay.
Yes, he extracted the root canal and got rid of the virus, got rid of the infection, and that was the answer. Removing that removed the cancer.
Remove the cancer. Yeah, it's
Simple as that.
As simple as that, right? Remove the splinter and heal the body.
Yes.
Right? Remove
Yes.
the splinters and heal the body, or watch the body heal. Any pain from the removal of the root canal or the extraction?
It was amazing. I was nervous, and he could tell, but
Yeah.
it was wonderful, if I could say that, from having a tooth extracted. No
Yeah.
pain, no swelling. He did it all holistically, and it was great.
Was that tooth giving you trouble prior to the extraction?
Yes, I had an infection there, and I kept telling him, I feel like a heartbeat in my mouth.
Yeah.
And that's when he found
Yeah,
out.
that's pretty remarkable. When you were first diagnosed with lung cancer, there has to be this fear that comes over you. What was that like?
The fear that comes over you is from the medical profession that instills this in you. You have to get this removed. It's growing and it's getting closer to your bone. This is what I can remember, like, in my head, and it's like, then, your family and friends that don't understand
Yeah.
the holistic approach, they're like, you have to listen to what the doctor says. And so, not knowing Dr. Smith at the time, I went and had the surgery. But like I said, no way.
Did the oncologist, thinking back, did the oncologist give you any or offer any approaches to, we'll call it the conventional method or treatment?
No.
No.
After the surgery, they said, well, we could do chemo or radiation, and I said, no.
Yeah.
We're not doing that. I'm not doing that. You told me that you got a clear margin. Why do I need
Right.
chemo or radiation?
Exactly. And prior to that, Carol, did you do a lot of research when you first got the surgery and then post-surgery? Between that and the time the cancer had come back, did you start doing a lot of research?
I did. I started, there has to be a different way. There has to be a better way. And I talked with my chiropractor about that.
Yeah.
And that's when he told me he knew Dr. Smith, and Dr. Smith worked with many cancer patients. And I was like, all right. So I went and looked up Dr. Smith on the internet and
there he
found
was.
Dr.
That's
Smith
great.
and made an appointment.
The more people I talk to about Dr. Smith and the work that he does, and his approach, the more they say, "Oh, I like that. I'd rather do that."
Yes.
I'm more attracted to that sort of that method of medical care rather than the we'll call it the tried and true method, right? What advice would you give to a cancer patient, a newly diagnosed cancer patient, Carol?
Well, I have been talking and promoting Dr. Smith, and for whatever reason, different people have been brought into my life with cancer, and I don't know most of them or some of them, and I told them, this is just my story, but there is a better option than going through breast cancer, than having surgery, than going through cancer is cancer. They want to put a name on it. It's just cancer.
Yeah.
And it can be removed in a less invasive way. It can be gone. You can be healed. And I try to tell them, I would not do that. I've given him Dr. Smith's card. I've given him his website. And you can only give the information. It's everyone's decision, but the medical profession has instilled such fear when you hear
Absolutely.
the word cancer.
Yep.
It's like,
Yeah, it's like it's a death sentence, and I've got to do what everyone else has done,
Yes.
right? Rather than going down this other path. And speaking of that, since you kind of went down this process, it's kind of in a weird way a rabbit hole, right? You know, do you believe that anyone in the medical profession really understands the nature of cancer and the cause of it?
in my opinion, I don't think so, only because if they did, they would offer other options. They would
Yeah.
look and research themselves and see that this does not have to be an invasive procedure. Surgery is not always the answer. The cancer can be healed. The body can get rid of the cancer if it's given the right tools.
Yeah, and you mentioned chemotherapy, a chemical, right, and radiation, just destroying cells that
yes.
you know are in our body, and you'd like to think that you know there's so much money in this, Carol,
Yes.
so much money in this.
Yes.
It seems like it's smoke and mirrors sometimes, you know, and I mean, how do you feel about that?
I agree 100%. That's what it is. It's money. It's all about the money.
Yeah.
It's not about getting the patient better with the less invasive process and getting to the core of the problem.
Yeah.
It's amazing. And with any sickness or disease, Dr. Smith is my doctor.
That's great. I love it. Well, thank you. Thank you very much. God bless you for coming in here and talking about your journey. And we all love Dr. Smith. And,
Yes.
and this personal experience with cancer is not only inspiring, but it's eye-opening to many of us because, you know, it's that, again, what we've been brainwashed into thinking is a
Yes.
conventional method versus not. But you've had firsthand experience, and that's there's nothing better than firsthand experience.
It's my pleasure.
You're welcome. I really just hope that you continuing to share this story with others helps them with their journey, and it'll help save some lives. So thanks, Carol. Appreciate
You're welcome.
your.
That was my intention, is to make, if I can reach one person and
Yeah.
have them reach out to Dr. Smith, it would help them.
Yeah, absolutely. Wonderful. Thank
Yes.
you.
You're
Thank you.
welcome.
All right, ladies and gentlemen, that is a wrap for Cancer Deconstructed. We're going to bring Dr. Smith back in a few moments, and we're going to wrap up this series with him. But this has been a remarkable docuseries, and can't thank you enough for joining us. We'll be right back with Dr. Smith in a moment. Okay, welcome back to Cancer Deconstructed. I am your host, Mark Iorio, and we are wrapping this up with Dr. Smith. This is a 10-part docuseries that we put together. We just had Carol Kessler on. Carol was a cancer patient and a patient of Dr. Smith's, and this kind of brings a close to the 10-part series on Cancer Deconstructed, Doc. It's been an incredible learning experience for me and all of us. The gratitude that I have for you and what you've taught me and the audience has been amazing. It's been unbelievable. Your research has been stellar to uncover all this real history out there that I think a lot of people are really unfamiliar with. And what's in the cancer industry, right? And what misinformation is out there, and what people need to do in terms of options that are available from you. Our intention was to bring this primary educational system to everyone, and we have achieved that goal, I think. Thank you for all your work and putting this series together. We appreciate it. What do you say?
I'm excited to disseminate the truth and get it out there so people don't get slaughtered. That's basically my goal.
Yeah.
Thank you so much for hosting this 10-part series. It was really phenomenal.
I think so too. Before meeting you and before going through this, there is no way that I would have ever assumed or thought that there were alternatives out there. And as I said to Carol earlier, I think, you know, we've talked about this often, that conventional medicine is not so conventional. It's like common sense is not so common, right?
Right.
You know, conventional medicine is not so conventional. Thanks, Doc. Appreciate it.
You're welcome.
Ladies and gentlemen, that is it. That's a wrap for us. We're going to put this program together and get this out to everyone out there, and hopefully, as we talked about earlier with Carol Kessler, we're going to save some lives. And thanks to Dr. Smith and all the research that he's done in helping people who are looking for alternative ways to treating cancer. Thanks very much for joining us.